Love to introduce our first speaker, a gentleman named Dave Chase. Raise your hand if you've never heard of Dave Chase, seen his writings on Forbes, heard about his institute, heard about the movie he's producing. Okay, I figured. No need for an introduction. With that, please welcome Dave Chase.
No, it's great to be here. I really appreciate everybody coming here. Going back to when I came back into healthcare, I was going to start a startup. And so, what do? You look for market gaps, you make some bets on how the future is going to unfold. And to me, this was back 7-8 years ago. And it seemed to be clear that things had to shift to more of a value and outcomes-based model, cut out non-value add middlemen. And that's, I think, pretty obvious, particularly to this group now, but it was less so then. And so I went out on a little bit of a scavenger hunt. Who's already doing that? And I saw Garrison Bliss here earlier. I guess it's powered off. So it was fun to see that. And see Garrison, I think he's like the father or grandfather of a lot of the practices in here. And anyway, as I went out searching for a market gap, what I found, I believe, is the greatest heist in American history. And I think the people in here can have a lot to say and do about that. So I'm going to get into it and provide a little context. I'd start out with, if you think about the 2016 presidential election, certainly the most unique one in my lifetime, I think the biggest media whiff on that was the story of the middle class. If you keep in mind that a definition of an economic depression is 2 or more years of income decline, by that measure, the middle class has been in a 20-year-long economic depression. It would have been actually shocking if there wasn't crazy stuff that happened. And so I believe there's an opportunity to really change that. And so I'm going to go into that in some detail. This is a chunk of a book cover for a book I've got coming out this summer. And I really believe that the healthcare system itself is the greatest existential threat to our country. And I don't think you can solve healthcare without direct care. And so I think there's a lot at stake in this room. Take a look at the youngest boomer, 52 years old, been working for 30 years. If you look at what the employers were paying for their health care, and bear in mind most people who aren't, the vast majority of people who aren't poor or old get their health care through work. And had healthcare costs grown at the rate of regular inflation from the time they started their career, versus what actually happened, if you invested that spread in an S&P index fund, the average American household would have over $1 million in their retirement accounts. Unfortunately, despite the fact that employers are spending far more on employees than they did 20 years ago, all those dollars and then some basically have gone to healthcare. If you keep in mind there's been 20 years of wage suppression and decline, and the result of that is 70% of American households have less than $1,000 in savings. Half of those people have basically no savings, and we now have passed the 50% threshold for over half the workforce has over $1,000 deductible. And so the math simply doesn't work in that instance. The one thing that is undisputed that we're the best in the world at in healthcare is medical bill-driven bankruptcy. And so we need to do something about it. And as bad as that is for the boomers, it's worse for millennials. If you read one book in healthcare, it would be David Goldhill's Catastrophic Care. In that, he goes through Becky, who's a millennial working for him, makes some assumptions about her life and how her income would grow, and basically she lives a healthy life. And he actually presents an optimistic scenario, which is that healthcare costs will only grow at half the rate of inflation, which I don't know if they've ever done. And in that scenario, again, very well sourced, you see kind of the part above the surface of this iceberg that is the things that Becky sees, her co-pays and her share of the premiums, and so got 600,000 over the course of her life. But really, the below the surface is all these other things that are directly going to pay to what I call a morbidly obese healthcare system. Those are all coming out of her paycheck. So in this optimistic scenario, half of her lifetime earnings go to healthcare. In a more realistic and maybe even still a little bit optimistic scenario where healthcare grows at the rate of inflation, 75–80% of her lifetime earnings go to healthcare. I mean, that's being an indentured servant. I think there'll be riots in the street before that happens. We can do something about that. And I think millennials are a particular opportunity because the oldest of the millennials are leaving the invincible stage of their life where they're starting to have their own kids, some of their own maladies. Like most of us, we didn't pay that much attention to healthcare if we weren't in the industry. And if you look at healthcare, it's pretty much designed perfectly for millennials. That is, if you do essentially the opposite of everything we do in healthcare. And so with that, I think that presents an opportunity. And one thing I would bear in mind, this is a little bit of an eye chart, but some of you may have seen this study of studies that Robert Wood Johnson Foundation did, and it basically bubbled up what actually drives health outcomes. And by the way, I'll make this deck available, so if anybody wants it, you can get the details on it. But basically, the upshot of this is clinical care only drives 20% of outcomes. The other 80% of outcomes are actually driving out overall health outcomes. So whether it's social and economic factors, health behaviors, physical environment, these are all the things that drive outcomes. And when you look at this next slide, should point in the right direction, this is data from Massachusetts, which I think is an interesting kind of preview of coming attractions. We know Romney Care was kind of the sort of template for Obamacare. And this is at state level spending basically since the turn of the millennium. And you can only increase taxes so much, so the dollars that are going to pay for government workers and Medicaid in Massachusetts have to come from somewhere. So you look at the items that they've come out of. Largely it's the social determinants of health. And while Boston is sort of held up by some as kind of a beacon of our healthcare system, I think it's a beacon of the dysfunction of our healthcare system. While there's obviously pockets of brilliance in places like Partners, you look at what it has done, and literally in the shadow of billion-dollar medical facilities is Methadone Mile, which is ground zero for the opioid crisis in Massachusetts. And that's an entirely healthcare industry caused issue. And we can do a heck of a lot better than that. Taking a step back, and I think any of this, I hope that many of you steal these slides, using them in your community. You're all leaders in your community. People trust the medical profession and doctors in particular. But one of the big picture things is this book that for the chairman of Gallup wrote called The Coming Jobs War. And he argues that we're actually in the early stages of World War III, and it's a war over jobs, and it will have as profound an impact on which communities have success and thrive in the future. And he goes through a number of things that you could imagine about what would lead to a successful community, but makes a point that healthcare costs, if you're a high value or low value community, that would wash away any tax break you could give. I mean, because economic development 1.0 was kind of just happenstance. You happen to be a port city or on a transportation hub. Economic development 2.0 was, throw some tax breaks to attract or retain and maybe put a marketing veneer on your community. Economic development 3.0 is playing the healthcare card. And we're seeing canaries in the coal mine on this in terms of companies that are actually acting on this information. So a good example of that is, there we go, IBM. They saw this. This was what they were seeing as far as their healthcare costs and what they were projected to do. And they realized that increasingly they weren't competing with HP and traditional American companies. They were competing against Wipro and Infosys, and so they really had to get their costs down, which they've done quite successfully. So that far right bar is not their reality. They've actually are spending about a third less than a typical company. And what this has done is really, they've done what I thought was a good way that a private equity firm we were talking to recently described it. So Blackstone, they have about 600,000 employees in all the companies that they own. About half of those are self-insured. And the first meeting that they have with a newly acquired CEO, they say it's a manufacturing company. They'll sit down, ask them this question: how's your healthcare business? And they'll usually get a puzzled response, puzzled look in response to that. And they're like, well, we're a manufacturing business, what are you talking about? And they've already, of course, looked at the financials and say they're spending $32 million on healthcare. So how's your $32 million healthcare business? They go, and by and large, what you see is the people who are running the spend in healthcare, they're not the people you would have run a $32 million division of a company. And that's one of the things that's going to really change and is starting to change. And you look at on the 401k and retirement benefits side, 401k administrator, that's a very serious role, well compensated, well aligned. And yet we probably spend twice on healthcare that we do on retirement benefits. And so that's going to present an opportunity. And you look at what IBM did when they were looking at basically where would they put jobs. They did this global study of their healthcare spend. And this is a variant on this graph you've seen before where you've got longevity, per capita spend on the vertical axis and longevity on the horizontal axis. And this is actually one of those graphs where you want to be bottom right. And so you see two clusterings of figures from 1975 and 2005. So you see all the countries kind of banded together in 1975, and then they all kind of move up and to the right. So costs have gone up, but also longevity. And then, in American exceptionalism, we stand out in that we are way off the chart, and then we actually backslide in terms of longevity. But then you see this Dubuque, Iowa. Well, that's one of the few communities that's actually their value proposition is like Japan or Netherlands in terms of bang for the buck. So guess where IBM puts thousands of jobs? In Dubuque, Iowa. So that's a different kind of mindset that employers are starting to bring. And one of the things that I've observed in healthcare is baked into almost every legacy business model inside of healthcare is this assumption that employers will remain derelict in their duties to manage a very important spend. I think that's a really bad bet. I mean, employers probably spend about a little over half of the healthcare dollars, perhaps a little bit less, but when you look at the profits, it's probably 2/3 to 3/4 of the industry profits, because most employers are basically like, Joseph Hazelwood. You may remember he was the skipper on the Exxon Valdez, or kind of drunk and asleep at the wheel. And that, they're heading towards the rocks. Most employers have hit that spot and are really going to do something about it. This is what I call the Bernie Trump slide. And so this is from the Wall Street Journal, a Brookings study that basically looked at, this was an article in the fall. And again, it's kind of at that micro household level. What has healthcare done to people? And you see at the top, of course, healthcare spending's gone up. That was just 2007 to 2014. And you look at what has come out of, to pay for that. This wasn't like we're canceling our vacation to Tahiti. This is food, transportation, clothing. The picture that they had in that article was a couple in Boise that was on their boat fishing because they couldn't afford enough protein. at the grocery store, so they are fishing for their protein. I mean, this is why you have the level of anxiety and angst and anger because of that, and it can't stand. So one of the things, I know we're going to talk about sort of category creation. If I have one thing that I have some competence in and passion for, it's sort of industry ecosystem shifting and thinking. And so what we're doing, and it's a bunch of us, is looking at how do we fix this. And the thing that in this kind of scavenger hunt that I've been on over the last 7, 8 years, it was who's actually already fixed healthcare. Because, you know, there's that old quote, the future's here, it's just unevenly distributed. And as we say on our Institute site, healthcare's fixed, we're just scaling the fixes. And so as I thought about this, and it was just frustrating to me that these people who theoretically it was their job to know things, in fact, talk about direct care, direct primary care. I remember talking to insurance executives, benefits consultants about DPC and direct care. And like, I'm pretty busy running a tech startup and doing some writing and stuff, and I'm finding this, and you would have thought I'd showed them fire for the first time. I mean, it was like crazy. And so I was like, just out of frustration, I'm just going to give it a name. Health Rosetta, because, you know, Egyptian hieroglyphics were indecipherable at one time, and the Rosetta Stone decoded those. I looked at the people who'd fixed healthcare as sort of, they decoded this indecipherable healthcare system. For a lot of people, it is indecipherable, and they just kind of lock up, or they look at it maybe depressingly like Middle East peace, where it's like, they know that's a big problem. They'd like it solved, but it just seems kind of hopeless and out of their control. And certainly the healthcare system profits from that feeling of helplessness. And so I called the Health Rosetta. And so as I thought about, you know, the magnitude of this problem that we have, this is on the order of civil rights, better food, climate change. I mean, this is a massive problem. And if you look at how those aren't all solved, but we've made some headway in those areas, much more than healthcare. If you look at what catalyzed those changes, it was catalyzed by media and film, and then some other things, but media and film. You know, on MLK's day, you know, it was the evening news and the morning newspaper. I mean, if he was alive today doing his thing, he'd probably be on Vine and YouTube and Facebook Live and this sort of thing. And, you know, you look at climate, you had Al Gore's film, I think it was a real catalyst. You look at, you know, the food movement, you know, things like Food Inc. and Super Size Me have driven that. And so I realized that, you know, media plays a big role. And so that's the first piece of this in terms of the kind of air cover, like how do you create sort of a better, you know, field to play on. And so there's the book I mentioned that is really targeted at CEOs of companies. I think they have an incredibly important role to play. And then the Big Heist, as I say, you know, I went looking for a market gap and found the greatest heist in American history. And so I just put that out there. It's like, hey, somebody needs to make this movie. Nobody's made this movie. We've got some wonky, you know, PBS-worthy documentaries, but Joe Sixpack doesn't, you know, watch those. You know, we need to reach people, and you need to do that in a very entertaining way. So I threw that out there and just hoped somebody actually would do that. People are like, that's a great idea. You should do it. It's like, I don't know anything about making a film. I still don't, really. But what I realized is in some ways it's actually an awful lot like a startup. You know, you build a great team, you tell a story, you raise capital, and by putting it out there, it's been incredible. The people that have come in, and my business partner now is on this is a former Disney, Sony president, and just some incredible things that have come from the community and some really great connections, some of which we'll tap into later as we come out. So that's going to hopefully create some awareness. I think Wake Up America is basically the objective there. And then it's down to the ground game. So I'm going to get in a little bit on this notion of education and certification and talk about that. I would say broadly, the way I would characterize that is if you're familiar with LEED, that has really taken sustainable building practices from a fringe concept 20 years ago to a marketing advantage for developers 10 years ago to the default way buildings are either built or remodeled. This is basically, the Health Rosetta is a blueprint for how to purchase healthcare smart. We're actually focused in on employers, but really it's actually not even employer specific or even US specific, but you got to start somewhere. So I'll go into what we're doing there. And then on the other piece of it is capital matters. And so one of the pieces of our investment fund that we have is an early stage tech venture fund. So when I met Zach and learned about what they were doing, it was really obvious to me because actually in my startup, we worked with a lot of direct care providers, and a bunch of them were asking us to build what Hint built. And I was like, no, we're focused in this area. And so we couldn't do that. And so it was like, click, we invested. So full disclosure, we're an investor in Hint. And there's basically, the Health Rosetta is also the investment thesis for our investment themes, both early stage tech venture, but also later stage, more private equity type of investments. So let me get into a little bit more about this sort of certification and what it is we're trying to do, and hopefully have you participate in this and be aware of it. We think that addressing the employers is really important, and what we have seen is great in terms of there are employers spending 20 to 55% less per capita on healthcare with significantly better benefits packages. They're not just like cutting off spend. And we've seen that in small companies, large companies, urban settings, rural settings, private employers, public employers. It really runs the gamut. There's no excuse. I mean, really, the common thread amongst these employers is they have a spine and a brain. And they're willing to stand up to an industry that really, kind of hoodwinks them, frankly, a lot of times. So let's go through a little bit more detail. There's some common threads that you see beyond the having a spine and a brain, which is certainly, primary care is foundational. You see that in every case. And then they take these, if you look at typical companies, depending on their size and whether they have a stop loss, it'll be as few as 6% of their employees will drive 80% of their spend because of outlier claims. So you have to have a really thoughtful strategy on that, and these organizations do that, and they take it like any other big cost item and tackle it. And so you see incredible things. My favorite is Rosen Hotels, and you look at the impact on their business and how they've been able to grow massively without having to take on debt. And they have a challenging patient population, employee population. 56% of their pregnancies are categorized high risk. So it's not like a layup. And despite that, they're spending 55% less. And so they can then take that money that would have otherwise been squandered in healthcare and provide great benefits. So employees have free primary care on the clock and free transportation to get there. After 5 years of service, employees get their college education paid for. After only 3 years of service, the employee's kids' college education gets paid for. But they don't stop there. They adopted a nearby crime-ridden neighborhood, invested in daycare, pre-K, after-school programs, so far 450 college educations. During that time, crime went down 67%, and high school graduation rate went from 45% to nearly 100%. The total investment for that was less than 5% of what they save compared to a similar employer. And so now they're adopting a neighborhood 5 times that size. So that's what's possible when you don't buy what I think is the biggest lie in healthcare, that you can't control healthcare costs. And so really what we're trying to do is provide this kind of good housekeeping seal of approval on good practices in healthcare. And it's a voluntary deal. And so like LEAD, they started out pretty focused, but they had a big vision. We have also a focus strategy, big vision. To begin with, phase 1, really years 1 to 3, is about people like benefits consultants and their counterparts inside and really gilding that role, leveling up that role inside of a company. Phase 2 is going to be about products and services and different components, and then longer term, 5 to 10 years out, are places. And in the breakout session, I can go into more detail if you're curious about what some of those things are. But we're starting very focused, basically like a startup in a narrow area, and proving it out. And we believe that employers are a particular opportunity because they can operate independently. They are shouldering the burden along with their employees, and there's an imperative to do that. And the thing that the employers that I spoke to earlier, they had to do a lot of heavy lifting, frankly, and their benefits consultants had to do a lot of heavy lifting to do that. We need to reduce the friction for them, make it a lot easier to do the right thing, and so that's a big part of what we're doing. And then really what we're trying to do, if you think about the benefits consultants, they have an incredible influence over what employers do, for better or for worse. And probably in 95% of the cases, it's for worse. And so you think about the parallel with, you may remember stockbrokers that existed like 20, 30 years ago and largely went the way of the dodo bird. Well, the smart ones reinvented themselves into financial and wealth advisors and thrived, and a new breed arose. And so we're really trying to accelerate this shift from, today's benefits brokers are the stockbrokers of yesteryear. And so we need to shine a light on the folks who are doing the right stuff, have the proper disclosures, and have their incentives aligned. Because what you find is that they're pitching themselves as a buyer's agent, but they're compensated like a seller's agent in most cases. They're, in a lot of cases, just a glorified sales force for the insurance companies and whatnot. So we really need to change that dynamic, and we think that's one of the ways we move the needle. So kind of wrapping up, we think if you fix how you pay for healthcare, that actually changes how we go about providing care. That in turn drives good things. I mean, the name of our tech venture fund is the Quad Aim Fund, because what I observed over these several years is, probably everybody in this room knows the triple aim, but what I found is the folks who are actually achieving the triple aim on a sustained basis focus in on the forgotten fourth aim, which is care for the care team. And so it's kind of common sense. Not only is that good for the care team, but that naturally leads to that better patient experience. I mean, I'm sure many of you have seen that's when the kind of the magic happens, where's that partnership between the care team and the patient. And by the way, it's also the non-professional members of the care team. Families have a huge role to play. And that's what leads to the better outcomes, and in the right models, that leads to the lower costs. And the approach we're taking is one where we believe it's an approach that can avoid incumbent obstructionism. It's kind of one of these things where it's so diffuse, it's kind of easy to ignore until it's too big to do anything about, and avoids politicization. So with that, I'll just wrap up. I have a breakout, I believe, at 11:30. This book, I'm donating all of the proceeds from the book to the Institute to kind of get this off the ground. The dollars from the crowd fund for the film, that's going to basically also, that share of the profits from the film will go to the Institute. The certification, some of that will provide the sustainability model there. So hope you join us. Hope you join me at 11:30, but hopefully, implicitly you've already joined this movement, but I hope you get even more active in your community. So applaud what you're doing, and thanks for your attention. Thanks. Bye-bye.